Monkeypox vaccines are not cheap at all. The statement from Executive Director of the Caribbean Public Health Agency, CARPHA, Dr. Joyce St. John, who says they are attempting to have access to standby vaccines if needed in the Caribbean. Sunil Lalla reports.
Executive Director of CARPHA, Dr. Joyce St. John, says the agency will soon be in discussion with member states about procuring at least some monkeypox vaccines if needed, but notes that even a drop in the bucket of vaccines would cost a hefty sum.
We had heard some prices about what could possibly be the number of doses put aside, and it was quite disturbing, the amount of money that it was.
Dr. St. John says one vaccine has been estimated to be upwards of US $100 per vaccine, and for people without smallpox vaccines, 2 monkeypox vaccines would be required.
I had heard something around $100 US a dose. So for most people, especially in the age group where it has been prevalent in this global outbreak, you will need 2 doses.
But monkeypox vaccines similar to COVID-19 vaccines are not easy to get, with even Health Minister Terence D'Alsing outlining a similar sentiment over the weekend. Despite this, the CARPHA director is not too concerned of any massive spread in the region.
The way we see things developing, we do not expect any real, how to put it, establishment of monkeypox, either in one country or more than one country. Yes, we expect importations.
But the vaccines are seen to be very effective against the monkeypox virus.
Research has been shown in the past that it's 85% effective. Therefore, there's a 15% likelihood that you can still get monkeypox.
CARPHA says it will continue discussions with member states on the possibility of procuring some vaccines for the virus. Sunil Lalla, TTT News.
In more news, don't get complacent. The warning from Minister of Health Terence D'Alsing as this country prepares for the eventuality of monkeypox cases. Trinidad and Tobago has not yet identified any cases of the monkeypox virus thus far. However, the minister assured that preparations are in place should one be identified.
CORA has been designated as the facility to treat with monkeypox, and I think you asked a very good question. There will be no mixing of COVID patients and monkeypox patients in any facility.
Responding to concerns on the transmission of the virus, Minister D'Alsing advised persons to be cautious.
Monkeypox transmission, as the CMO has said and I have said, is mainly close skin-to-skin contact. So any activity or endeavor that encourages close skin-to-skin contact without clothes is where the monkeypox virus could be transmitted.
251 additional people have tested positive for COVID-19 in Trinidad and Tobago. The Ministry of Health says those results were from samples taken between July 25th and July 26th. The total number of active positive cases is 6,190. There were no COVID-related deaths in the past 24 hours. The death toll remains at 4,046.